Hey there, Dr. Chris Cooper here with Cascade Chiropractic Wellness. I got Mark here. Mark is a new patient. We just took a history on him. He's had a couple things going on, including some old hernia surgeries. Today he's presenting with some tension and pain in his upper back and shoulders, both shoulder blades kind of up through the neck, and then this strip down in here. No radiation, no nothing like that, but I'm going to be doing a full exam on him. We're going to be checking shoulders, we're going to be checking low back, and let's get started, Mark. Yeah, that's good right there.
Perfect.
All right, so stand here for me, please. We're going to see how well you bend forward first. So bend forward, touch your toes if you can. Pretty good. So a little bit of loss of motion through here. Does it hurt when you get that far?
Yeah, I can feel it like really kind of tight in here.
Just local? Or does it no radiation?
Yeah, right now it's just kind of local to there.
Okay, stand up tall. Hands on your side, do a side bend. Good, go that way. Those both look good. Any pain with that?
I can feel soreness.
Same spot?
On both sides there.
All right, I'm going to hold your hips. Arch your backs towards me as far as you can. Any pain, any pinching?
A little bit through, kind of through here.
Okay. And then we're going to rotate too. So rotate your hips. Just kind of roll the whole thing. Good. Any problems?
That feels okay.
Okay, let's check the neck too. So chin to chest. Excellent. Look up towards ceiling. A little less, and I heard a little pop. Did it pinch or anything when you got that far?
No.
Okay, ear to shoulder. And go that way. So that's a lot less, and I heard another little pop.
Yeah. Right.
Is that
feel kind of tight?
Okay? Similar or one more than the other?
Pretty similar.
Okay, and then rotate. Good. Good. And those both look fantastic.
Yeah, it feels fine. Like a couple weeks ago, I could like barely turn this way. And
Was it this part again? Like
yeah.
Okay.
I would like get over here and I'd feel like shooting pain, and I guess it just kind of worked itself out naturally.
Yeah, sometimes it happens. So let's check shoulders too. So have a seat here for me. And if you want to keep Mark in the frame. So palms up, arms up like this as far as you can go. Not bad. The left seems a little less. Does it feel different?
At this point, it feels tight and sore kind of everywhere. Right
Okay.
now.
Stretch back as far as you can. Pretty equal. Any pain at all?
It's just kind of same little tightness on the sides.
Okay. Cross your arms as far as you can go. Not bad. And then Snow Angel. You feel it?
Yeah.
Is it like a pinchy grindy or what is it?
Yeah, like this one when I came through in the top, almost like a big kind of pop.
Okay. I heard that. Painful too.
Yeah.
Okay, arms up like this and roll back. Okay, and then roll underneath. Not bad.
Yeah, this one I can feel like a lot of tightness on this arm there.
Okay, reach your arm across like this and lift up. Painful at all? Okay, then let's do the other side. Painful at all?
Here.
Okay.
Here I feel it a lot.
So I'm going to do a couple orthopedic tests. Some of this is checking for rotator cuff, some is checking for like impingement, weird things like that. So push up here. Does it hurt at all? And thumb down. Push. Pain? Okay. Bring your arm like this. Pull. Pain?
No.
Do one of these things for me. Anything?
No.
Okay, arm like this. You're going to go like that. So push here. Pain? You bring it up like this. You're going to do one like this. Push. Pain?
No.
Okay, let's repeat on this side. So thumb up, push. Anything?
Wow.
And thumb down. Push. Anything?
Feels weak.
Weak.
Yeah.
Okay. Bring your arm up like that. Pull. And twist. Anything?
No.
Okay. Hand down like here. You're doing one of those again. Anything?
A little bit.
Okay. Hand up like this. You're going to do one of those things. Push. Anything?
No, but feeling very weak again.
Okay.
And like feel like this arm was just like had not nearly as much power as this one.
Yeah.
Hold
Bring up like here and push.
on. Ooh.
Similar.
Yeah, a lot of pain here actually.
Okay. Let's do this one and push.
Actually, same.
Same.
A lot of pain here.
Okay. Now just go relaxed. Does that hurt at all? Not too bad?
No, not too bad.
Does that hurt at all?
No, it feels like a stretch.
Okay.
But no.
Can you reach like this? Like just touch your back?
Yeah.
Or,
Like
yeah,
over.
yeah, that way. Good. Come back here, Alex. You relax. Okay, relax. And do the other hand. So significantly less. Okay, relax.
Super tight and painful all through here.
And then reach this way. Great range of motion. Okay, now go to the other one. So
Nowhere and super painful.
significantly less again. And so both of them in different ways though. In different ways. So you're rotating a different way. Let's check one more thing. So this is shoulder blade. So, here, come back here, Alex. I want to show you this. So, when I'm feeling here, I'm going to outline the border of his scapula. So on this side, scapula is kind of protruding a little bit. It's like it's winging off, just a tiny bit. This one is stuck. So when I grab lateral border of his scapula here, and I push, it just doesn't move. There's nothing. His whole body's moving. Any motion here is coming from all of this, not from the shoulder blade sliding. When I push on this side, the shoulder blade actually jiggles, but it's pushing out. There is a bulging here. And so you got a winging scapula here, a stuck scapula here, and a lot of rotator cuff involvement on both sides. But no impingement.
It's crazy when you pushed here. I really couldn't hold myself. When you pushed here, I felt
It's just jiggling.
normal.
Shoulder blades are supposed to glide. If the shoulder blade glides, it allows this whole thing to move normal. When it's not gliding, it's going to move. Your body's going to make it move, but it's going to happen here, it's going to happen here, it's going to happen here. And so all this stuff compensates to make the motion happen, but that compensation leads to bad body mechanics. Everything starts to wear down faster, and so that's where the pain comes from. Okay, we're going to do a couple more tests here. This one's for the neck. Does it hurt at all if I push like this?
No.
If I pull up like this, does anything feel better?
That actually feels good.
Okay.
I feel like.
If I push on you like this, does anything hurt in the neck or go down the arm at all?
No, I can feel a little tightness here.
Okay. If I push like this, anything hurt in the neck or go down the arm?
Feels kind of tighter than the other one.
Okay. All right, so palpation-wise, we have some trigger points in both sides. Tenderness either side?
Definitely left. Yeah.
Like this guy.
Yeah. Ooh.
So that is a massive trigger point. I'm just rolling my fingers over. This is upper trap for sure. Kind of the anterior border of upper trap. And that thing, massive, 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 massive. So we'll definitely be working on that too. But I'd love to get all this to relax also. Okay, let's check some low back stuff. So lay on your back for me, please. Face up. We're going to do a bunch of low back tests. Some of this is to check big, scary stuff. Some of it's not.
Okay.
More basic stuff. So lift this leg up to meet my hand. Does that hurt the back at all?
The back, nah.
Okay, lift this one. Anything? Okay, relax. If I lift you up, does anything hurt in the back or down the leg?
Not at all.
Okay. If I lift this one up, does anything hurt in the back or down the leg? Fantastic. Okay, now let's let this leg go relaxed. Painful? Pretty sticky towards this edge. Does it pinch at all? Okay. If I push on you, anything?
No.
Okay. Ankle on the knee. I'll let that relax. Anything?
No, I feel a little tight in here.
Tighten the hip. Okay. Now that's tight.
Yeah.
Does it pinch at all?
No pinching.
Just
but I
tight.
can definitely feel it. Yeah.
And if I push? All
Feels
good?
very tight. It feels like that, like there's no give.
Okay. And ankle on the knee?
Just like very kind of tight in the hip again.
All right. 2 more tests. So Alex, focus in on his legs here.
Okay.
I'm going to push you way up here. Yeah. So you see how as this leg moves up, this is a sign of a tight hip flexor, tight psoas. Is this jeans?
Bending.
Uh-huh. Is this jeans or is this you? Is this tight jeans or is this?
I'm not sure.
Well, it's all right. That's the positive sign though. So on this side,
The jeans are probably
a little less on this side. So I would say maybe not so much jeans as it is you. So this leg comes up less, but it still does come up, and that's a sign of a tight hip flexor. That's kind of one thing I was wondering about with hernia surgeries.
Yeah.
Is sometimes the musculature underneath gets kind of bound up because there's scar tissue in there now.
Yeah.
And so scar tissue reacts differently than normal tissue.
One thing I noticed a lot back when I was like doing intense workouts is like I'd watch myself doing pull-ups and like this leg would be bending like involuntarily, and I wouldn't even be aware of it when I was like doing
Like
reps
up
until I
into
watched
this.
back, and it'd kind of be like
Yeah.
this, like while I was like.
So you might have a hip flexor tightness difference on both sides. So let's check some more stuff. Roll face down for me, please. There's a hole for your nose right here, an armrest underneath your face. Whew. So when I push on this right SI, it's very stiff. A little posterior. Does it hurt when I push?
Doesn't hurt, but I can definitely feel like
You can feel it.
kind of soreness. Yeah.
Okay. If I push on sacrum at all?
No.
If I push this way at all?
No.
Okay. So here's L5. A little bit sticky.
Yeah, on your left side, I felt that.
L4 too. L3 feels better, but still sticky. L2 feels sticky. 1 feels sticky.
Yeah.
All right, so it's all sticky. So these joints should be able to move back and forth pretty easily. And they should feel equal left to right. Your left side is a lot tighter than your right side. But this is the right side that's tight. So tight, tight. So we kind of got this cross thing happening. And then up through here too. Oh my gosh. All right. Do you feel that thing?
A little bit. I feel like there's like certain spots that like really bring it out. Yeah.
Yeah. So I'm pushing on a rib here. Where are we? So rib number 5 on the right. Just a little bit posterior. So a lot of times people say, oh, my rib's out. And sometimes people get angry like, oh, ribs don't go out of place. But what I say to them is it's stuck. It's stuck in its motion. Ribs are supposed to move. When you breathe in, they flex like this. When you breathe out, they flex like this. If you have a lot of allergies and you're sneezing a lot, it puts a lot of pressure on these specific joints, especially if you're sneezing. And a rib could get stuck. And so it's stuck in this position. It feels like it's poking out, but it prevents a lot of this mobility here. And I wonder how much this is related with this shoulder blade and this rib. So we'll get all that fixed up too.
Yeah.
All right, so have a sit up here for me, please.
Man, that spot on the side is like so tender that it's just like
You felt it right away?
in here, just like that one little touch. It's like,
So let's talk about what's going on. So on you, you had a lot of this right SI stuff. When you are dealing with SI joint dysfunction, sometimes you'll have it radiate down the leg, but not every time. Sometimes it just gets stuck and all this stuff starts playing a role. I think on you, it's a lot of this lumbar musculature, but also how well these individual joints move. So if a bone isn't moving left to right when I'm trying to rock it when you're face down,
yeah.
there's something going on. But then we get into what's going on here. So now you're laying face up on the table. When I was rolling through this right leg, this was sticky. The actual joint was. And so this one wasn't too bad. Like when I really got you into provoked it a little tight, but this one was immediately tight. And so there's a little bit going on in here. And then there's your hip flexor is kind of like this. It sits like my arm is. It's a big, giant muscle that spans along the front side of your spine here and through your hip. Well, you're tighter on the left than you are the right side, but they're both tight. I wouldn't say either one is fantastic. So we'll work those out too. And then when we're dealing with shoulder blade stuff, we're going to build a human here. So now we're looking at your back again. Here's your shoulder blade. This is your right side. So this is collarbone, shoulder blade, and that's your arm bone. Okay. And all these little things represent like little tendons and part of your rotator cuff and ligaments and things like that. So when you come in like this, here's how it's supposed to sit. Well, here's one of your ribs that's out of place over here. So if this thing is elevated like this, it's going to affect how this thing moves. But on the right side, your shoulder blade's winging a little bit, so it's like this. And if it's shifted up, and I'm exaggerating so you can see it, but if it's shifted up like this, it's going to change how it plays with this. It's going to change how it plays with this. It's going to change how it plays with this. And so there's a lot of fixes we got to get going on here. But I think we can do it. You've seen our stuff on YouTube. You kind of know what to expect. Yeah. You okay with hands-on therapy? Yeah. You okay if we dive into muscles too today?
Yeah. Whatever you think is safe, I feel safe about. So.
Okay, let's do it. Let's get started.
Yeah. I'll let you know if there's any discomfort. I mean, I guess the only thing I'm nervous about is like potential pressure when I'm on my stomach and then hurting here. But I'll let you know.
I'll kind of check in as we go.
Okay.
Make sure we're not dealing with anything. Last thing I would want is to make it uncomfortable or sore or anything like that.
For sure.
Okay, so let's go face down first. We'll start with some muscle work in the back, up through the shoulder blades, and then we will start into the adjusting part. We'll kind of move around as we go. Some things will be better when you're face up, some things will be better when you're face down. So we'll just kind of roll you around and work around the body. All right, so I'm going to dig an elbow into you. We're going to go right above your pelvis, right to the side of L5 and L4. And I'm kind of digging a little bit hard. Is this too much?
That's fine.
Okay. My goal here is to get this to relax. If I can get it to just soften a tiny bit, the adjustment will feel a lot more comfortable, but what's the chicken and the egg here? Which one came first, the tight muscle or the sticky joint? And I don't know the answer to that question. So if we can just fix them both, we'll make ourselves an omelet. Alex liked that one.
Oh, man.
Alex liked that joke. I'm going to go to YouTube hell for making that joke. So same thing. Sticking an elbow right. There you go. Is that okay?
Yeah.
The reason I'm using an elbow is because it's a little easier on my thumb and body mechanics for how deep Mark's muscles are. A lot of his tension is not superficial, it's deeper into these muscles. And so if I could do a thumb, but it would probably be more painful for Mark and for me.
A lose-lose.
Lose-lose. Doing okay?
Yeah.
Okay. We're going to check a couple other muscles here. Since you had tight hip on the left, I want to see if piriformis is playing a role. It's a little tight, but it feels not so bad. Is it tender at all?
I guess a tiny bit on the outward part of the stretch, but
like way out here.
Yeah.
Okay. So let's just work this out a tiny bit. One of the reasons I ask if it's tender is because just because it's tight doesn't necessarily mean it's a problem or a part of the problem.
Gotcha.
But if it's tender and tight, pretty sure bet that something's going on here that we could fix. Like that thing.
Yeah.
So I'm on a trigger point here. We're just working this out. And you can see I'm pretty deep on this muscle. Piriformis is beneath the glutes.
That one always hurts on myself.
Yeah.
Yeah.
I definitely felt it like loosen up.
Yeah. That's what we're aiming for. Just a little bit of loosening goes a long way. This side, not too bad. I mean, I feel something right there. Anything at all, or not too much?
Not too much.
Okay. We won't dwell too long on this side. All right. Okay, so for Mark, sometimes a drop table adjustment is really nice for SI joints, but I don't think we're going to do that today just because of the location of his hernia repairs. It's when you do a drop table, it adds a shearing force, and I don't really want to get any shearing forces near hernia repairs. So we'll do those side posture, and we could do those just as easy side posture. But let's get this bad boy. So I'm going to do a little test push. Tell me if this feels any discomfort down low in the abdomen. If I kind of push into you like this. Is that all right?
Yeah.
Okay. So let's get this adjusted. So take a big breath in. A big breath out. Excellent job. You okay?
Yeah.
Nice. Nice. That thing, can you feel the difference?
Oh yeah. Immediately.
Kind of fun, huh? Ribs are fun to put back in because it feels like magic. Okay, big breath in. Big breath out. Excellent job. Alrighty, Mark. Let's have you lie on your side. This side up in the air, please. Here. Okay, Mark. So we're going to aim right through SI, but I also want to get L5, L4, and its friends moving better. So roll this way. I'm going to roll you forward here a little bit. Right there. Okay, how's SI? A little bit more on lumbars. Yeah. You okay?
Yeah.
Okay. Okay. So this one is a lot of L5. So we're just going to roll you a little bit.
Ooh.
Okay?
Yeah.
Good. Let's start with neck, and then we'll work our way around. We'll jump into shoulders and everything like that, but I want to address neck first. Okay, we're just going to do passive range. A little tight. Pretty good. Very tight. Pretty good. We're doing segmental range of motion, pushing on all these joints. Here it stops. I'm down here at C6. Can you feel that?
Yeah.
And this side, not too, oh yeah, there you go. That's C4. It's kind of lateral flexion again. Maybe a little bit of C5. Does it get worse as I get lower? Or is it kind of more localized up here?
It seems more localized. Yeah, it doesn't seem as tight as the other side.
Okay.
Is that deep?
So let's do one side first. We're going to get this neck to move through its normal range. Just come way over here and let this head super relax. one more here. Let that relax. Good. Excellent. Doing okay? Okay.
Fantastic.
Let's dive into shoulders. So I'm going to start with collarbone. So let's let this go floppy. And we're just going to... Already found something. You feel it clicking?
I already feel painful.
Okay. So we're going to do an adjustment here too. This might be the first time this channel has done an adjustment on sternoclavicular joint, right where your collarbone meets up here. So come close over here, Alex. So the joint we're going to be working on is right where collarbone comes in and attaches to the sternum. On Mark right here, it feels a little more protruded, so it's shifted this way. But when I move him like this, there's no motion happening here. And it's supposed to glide a little bit, and it's supposed to rock a little bit. So we're going to do a little push and get this thing back normal, okay? So big pull here. Look with your head to your left. A little push here. Nice. Okay, come back neutral. Beautiful. That feels awesome. Can you tell a difference at all?
I feel something. It's, I guess, a little...
It's kind of a painful adjustment.
Yeah, it feels a little...
There's
there.
a lot of nerves there, and so it kind of hurts to get pushed on. But the joint's moving again, which I'm happy about. So this is AC, right where the collarbone meets the shoulder blade. Feels better. Just kind of mobilize. AC joint doesn't adjust very well, but it mobilizes really well. And a big stretch on the glenohumeral. This is your ball and socket. Good. And then let this relax. Yeah, man. You feel that click?
Yeah.
So this is radial.
Wow.
This is radial head of the elbow. So his is a little posterior, but also non-radiating. Come over here.
It's crazy. I'm not sure if I even would have felt that if you didn't say it.
I'm telling you, that's why we
Finds
check.
all the things.
Well, it's why we check the full upper extremity, because it all works together. Like, you wouldn't think that this is affecting your shoulder, but I promise you it does. So let this relax. A little push. Here you go, buddy.
Yeah.
That's not doing great.
Wrist feels nice.
Am I allowed to curse?
You get whatever flies.
Oh, maybe we can make a fun little bleep sound. That'd be good.
Okay, let that relax. A little clicky on this side too. It moves
Yeah, I
better than
feel
the other
like
side.
When you come back in.
So I want to see if that click is something we could get rid of. So we'll look that way. Let this relax. A little push. Good. Okay, come back neutral with the head. Smooth. Yeah, I would say it even moves better. AC joint again, so let's do AC joint on this side too. Crunchy, huh? And this is the shoulder that popped during the exam, right?
Yeah.
There it goes. Good. Okay, let's do the big shoulder joint again. Let that relax. Beautiful. And this side feels good. Anything weird?
Yeah. Feel okay.
Cool. Okay. Let's do rotator cuff stuff. So come around here, Alex. So we're going to check subscap first. It's a big muscle underneath your shoulder blade, in between your ribs. Feels pretty normal. Is it painful or tender at all?
A little tender.
Okay.
I guess more kind of underneath.
Like more like this stuff or more like this stuff?
Yeah.
That stuff.
That's
Okay.
it.
So let's really get in there. So let that relax again. So what I'm going to do is push a thumb and use Mark's arm to get that muscle moving. This is a way we can pin and stretch the muscle and not have it be so insanely painful. But Mark, is this comfortable?
I mean, I definitely feel
Be honest. It's not a comfortable move.
It's pretty painful.
You'll feel the difference after though. Okay, relax. It's one of those things that's like if you can handle this for 10 or 15 seconds, man, it's worth it. So right now I found a little knot. It's like a little, maybe like an almond-sized trigger point. And we're just going to wait for that to dissolve, relax, stop existing. There you go. There you go. Doing okay?
Yeah.
Okay. Okay, now we're going to move to this stuff. So this is still part of rotator cuff. We're on Teres Minor this time.
Good job, Mark.
Yeah. Doing okay?
Yeah. Feels really good. Feels like how I would try to massage it, but I can't do it myself that way. So
This is hard stuff to work out yourself because it's, for one, it's in weird spots, but in two, it's like they're very specific muscles with very specific movements and yeah, good job. And if you could get it to relax, man, does it feel good. We'll go through all those shoulder motions again and see how you do after this. Good. Fantastic. You're doing great so far. Okay, let that relax again.
wow. Yeah, that's really painful.
Okay, let's check this side. Okay, relax. Very tight.
Yeah.
Very, very tight. Does it feel different in tenderness wise?
It feels more tender than this side when you began.
This side feels more of a general tightness, where the other side was very lumpy. More trigger points. Have you ever injured your shoulder?
Not that I know of, aside from this kind of rotator cuff thing.
Okay, let that relax. Good. Good.
Yeah, it actually doesn't feel as bad as this side.
That trigger point was pretty gnarly on the left side.
Yeah.
Whenever we land on a trigger point, it's like, uh-oh, here comes the pain.
Yeah, I can still feel it over here.
It's like a knot. Like you get these knots in those muscles, and this is a muscle that never gets touched. All right. So let's check one more thing. Check into, let that relax again. So here's Teres Minor. Not too bad. Tender?
A little tender. Not too bad.
It moves a lot easier than the other side did.
Yeah, this one, the pain changed a lot through the range of motion, whereas this one's kind of staying that same level.
Yeah. Good. All right, let's dive into hips. So this one was the tightest one. So we're going to do a couple drops through that hip. This is great for posterior capsule hip tightness. Excellent. And I'm just pushing through the tightest spots. Maybe doing a little bit of internal rotation at the hip. Good. And now let's do a big, long axis distraction. So let's just let this go floppy. Yeah. Good job. Okay, let's do this one. I felt on this one more like deep in that. Is that still nothing?
I feel it over my abdomen a little, actually.
Really?
Yeah.
If I push on you, does it get worse, or is it more?
Nah.
Okay. Right through here. Let's recheck. Good. All right, let that leg go floppy. Fantastic. Wonderful hip openers. Okay, so let's check hip flexor stuff. So I'm going to start real gentle. Some of the spots I'm going to touch are kind of near hernia stuff.
Okay.
So if anything gets like, iffy, let me know.
Okay.
Because I don't want to even go there. So iliacus, that feels pretty normal. Tenderness in through here?
A little bit, but
Not too bad?
not too bad.
Okay, so that's where inguinal hernias sometimes happen. This one is more psoas. Ooh, yeah, that's a spot. Any tenderness with like surgical stuff?
Not with surgical stuff.
Can you
but
feel that thing, though?
It feels tight or
Okay.
yeah.
So what we're going to do is dig some knuckles right onto that psoas.
And yeah, that's okay. Nothing feels uncomfortable.
Good. And we're going to do just a few of these. So this is another pin and stretch type move.
Feels really good.
Mark says it feels good. So knuckles aren't moving, but his leg is. So we're shortening and lengthening psoas underneath my pinned knuckles. That's a really great way to massage. And you can see how deep I am. I am on that psoas. Good. Doing okay?
Yeah.
Okay.
Yeah, it didn't hurt. It felt like it was like good being massaged.
Good.
So asses are weird things.
Now this side's tight.
Yeah, it doesn't feel like there's something to get
No.
there. It doesn't hurt.
No tenderness though.
Yeah. Oh. Yeah.
Deeper.
Yeah.
So same idea here. This time instead of using my knuckles, I use my thumb and using Mark's leg to do all the muscle movement I need. Nice. There you go. There you go. Good job. Good job. Okay, Mark. Let's check here too.
Super tight.
A little bit. I wouldn't say as hardcore as the left or the right side. Any difference? Tenderness
Kinda
wise?
similar.
Similar, okay.
Yeah.
So same thing. Come in, 45-degree angle, land on psoas. And I'm aiming for the tightest spot. And then we just go through the motion. go. Good. Good. Nice. All right. How you doing?
Good.
Okay. Almost done. We got the crazy shoulder adjustment now. So have a sit up here for me. And swivel your legs around this way. So stand back here, Alex. So we're going to do this shoulder adjustment. You might have seen me do it before on another YouTube video. It's basic.
This is the punchy one.
This is the punch.
I've had this one. It feels amazing afterwards.
The after is good. The during feels like you're getting punched in the back.
Yeah.
So we're going to see if we can get this to move and see if we can get this to shift down and around. So let's do this side first. So reach hand across chest, just like that. Let this go floppy. Let me hold you here. There you go. So it's this motion right here. So we're going to come in, do a little push. Good, a little bit more. Good. Okay, reach this one across. And same idea. Let this go relaxed. So this one's a little different. Right through here. Yes. It couldn't have gone better. Relax. Nice. Okay, one more thing. Have a stand right here for me, please, and turn to face that way. Put your hand on your hip here, and when I say go, what you're going to do is you're going to push your elbow back into me, okay? Kind of like a chicken wing. But relax first. Okay, push. Okay, hand on hip. Chicken wing. Good. Okay, move around a little bit, see how you feel.
A little pinching again.
There's a lot of things in here I'd love to dive in deeper and get worked out in terms of like muscle wise. I think on future visits we're just gonna go to town. Like I'd love to get all this to just super relax.
Yeah.
We did a lot of stuff today though.
Yeah.
So I'm gonna give you a bottle of water on your way out. Make sure
Okay.
you guzzle that. Anytime we're doing psoas work, you gotta guzzle.
Okay.
You gotta guzzle the water, otherwise you'll feel sick, like you got the flu or something.
Yeah. Okay.
All right, any other questions?
No, thank you.
Okay, cool. So thank you, Mark. Thanks for watching, and we'll see you next time.